Good morning, good morning. I'm Dr. Dale Dangleben, and what's on my mind? This is the medical tidbit of the morning. It's Friday morning, and usually I don't do Friday morning tidbits, but this is an extra. Next week is a holiday week, so who knows? I want to talk about the use of corticosteroids, and in the vein of what I've been talking about this week, in terms of side effects and things like that. I think it's important. And what I'm talking about hydrocortisone and things like that class of medications, right? And I want to touch on asthma because that's the most common, chronic illness affecting, our black communities, especially, black children. Black children are twice as likely to have asthma, right? And black adults are more likely to have severe polycontrol asthma, right? So because of this, we receive more frequent courses of these systemic corticosteroids. I'm talking about prednisone, methylprednisolone, dexamethasone, etc. And it's not just in the emergency room. I'm talking about even in the outpatient settings, right? So steroids save lives, right? Especially during these asthmatic attacks, but they carry serious side effects, right? That tends to be overlooked, especially in black patients, right? The two most dangerous is severe hyperglycemia, which is severe increase in your blood sugar, and also vision loss over time from cataracts and glaucoma, right? So we have to look at this, from different angles, right? Why do black patients get more steroids in the first place, right? We have the overlapping risk factors, the higher asthma severity I talked about. There is more environmental triggers, the mold, the pollution, smoke exposure, right? And less access to maintenance inhalers, right? So there's more visits to the emergency room, okay? So that's important. The underprescription of preventative therapy, right? Black patients are less likely to receive inhaled corticosteroids, right? And the long-acting bronchodilators, right? Less asthma education and less allergy evaluation, right? So this leads to repeat trips to the ER, burst of systemic steroids, which can then cause worse side effects, right? And there's a lot more to it in terms of the occupational exposure, substandard housing, less primary care, right? And the continuity of that care. So there's a lot when we have to look at just such a topic. But again, I wanted to talk about the severe hyperglycemia. We're already at risk for increased diabetes, right? But steroids increase your blood sugar, right? So we're already at baseline risk for diabetes, and if you're on a steroids, the chance of increasing your blood sugar is high. All right. So that is very, very important. If you have a 5-day burst of prednisone, right, that can actually spike your sugar into dangerous levels. All right. So these are the things, and every time I come on here, I want to address the doctors also. I always do. You have to educate your patients on these things, right? So that's important because the patient comes with an asthma flare up. You treat them with the steroids, and you don't tell them anything about the blood sugar, and some of them are diabetic, right? Right? No access to glucometers, no follow-up instructions, no warning signs. We have to educate our patients, all right? And that's the problem because it becomes a cycle. They will keep coming back and back to the ER. The long-term diabetic complications get worse, all right? The kidneys get affected, all right? So, and this hyperglycemia goes unnoticed from this steroids use, right? Vision gets worse, right? Blood sugars are high. We talk about 400, 500, but this is preventable, okay? And these steroid bursts over time, affects your eyes, like I talked about, the cataracts I talked about, right? It accelerates the formation of these cataracts. Right? I'm no expert in that, but I know that much, all right? So just wanted to put that out there in terms of the cataracts, the glaucoma, right? Steroids increase your risk by increasing your intraocular pressure, and over time damage to your optic nerves, obviously, because of the hyperglycemia like you would see with, the diabetics, okay? So I just wanted to let you guys know that these things are out there, all right? There is even something called steroid-induced psychosis, right? And that is something for a different time, different talk, different person to talk about. But these are the things, right? You have sleep deprivation, you have high stress, you have prior mental illness, you have all these other things going on, and these steroid bursts will just exacerbate these things. So I just wanted to, put that out there. These things are real, all right? And clinicians, we must do better. We must do better for our patients, for our community, and take action, right? Better management of asthma, better controlled inhalers, right? Treat the allergies, and environmental intervention, right? The pollution from garbage and smoke and tire burning and all these things but have to be put into context. All right? That's what I wanted to put out there today. Have a great day, guys, and a great weekend. Peace.